Hello, I'm Joanna Juvelis, News Director for Belmont Media Center, and you're watching News Now. Joining me today is Lindsey Sharp, Health Agent for the Belmont Health Department. Welcome, Lindsey.
Hi, thanks for having me.
Great to have you. And today we're going to talk about upcoming booster clinics that the health department is having. I keep seeing flyers about them. So what do you want people to know about all these upcoming booster clinics?
We just wanted to, put all of the information out there to make sure anyone who hasn't seen the flyers or has seen past flyers and maybe the info is not the same for each one. So we just wanted to make sure to go over all of that. So to start, I'll just go over the dates for all the clinics we have planned for the rest of 22. It could be that we add a couple more along the way, but this is what we've got scheduled so far. So we've actually got one this Thursday, November 10th. It's going to be from 1 p.m. to 5 p.m. and it's at the Beach Street Center. Anyone's welcome to register for that. And in a little bit, I'll go over eligibility criteria. After that, we've got Thursday, November 17th, and then we've got Thursday, December 8th, and then Thursday, December 29th. So all Thursdays at this time, and we might add some more, as I've said.
Are they all at the Beach Street Center?
So usually they're either at the Beach Street Center or at the Bethel Temple Center. So both right in sort of central locations in Belmont. This Thursday's is at the Beach Street Center, and I believe most of the rest of them will be at the Bethel Temple Center, but it's always noted toward the bottom of our flyer, the time and the location. So you can always double check that. And you're also always welcome to give us a call if you're not sure where it's going to be. So there are still a few slots left for this Thursday's clinic, which, as I said, is from 1 p.m. to 5 p.m. at the Beach Street Center. So definitely register for that if you are interested and in need of a vaccine. To go over eligibility criteria just a little bit for anyone who, is kind of confused, because I know it's changing all the time and they're adding, more information. So anyone who is 3 years old or older is welcome to get the primary series at their clinic. So that's if you haven't had any COVID shots yet, you're welcome to start and come to our clinic as long as you're 3 or older. Anyone 5 and older is welcome to come and get their booster doses if they've already had the primary series as well. Those will be the bivalent boosters. So that's the new booster that's sort of supposed to encompass more of the variants that we've been seeing. And that's great as we move into colder weather and it's, more time inside, more time in enclosed spaces, that sort of thing. Great to get your booster. And sort of the only eligibility criteria for that is you have to have had your primary series. So your first 2 doses of Moderna or Pfizer, or your first dose of J&J. And then it has to have been at least 2 months since your last dose of either the primary series or a previous booster. So as long as those criteria are met, you're welcome to come get the bivalent booster at our clinics. We also do have flu shots available at all of our upcoming clinics. Those are for ages 3 and up as well. And one thing to note is for the flu shot, the vendor that we use does need to see your insurance information, your insurance card, because while COVID vaccines are free regardless of insurance, the flu shot is not. So you just need to make sure to bring that insurance card with you if you do make an appointment for flu, either in addition to COVID or just flu. Of Pfizer, Moderna, Pfizer and flu, or Moderna and flu. So you're welcome to select those if it applies to you. Okay. And even if you are just getting the COVID shot, we do ask that you bring your insurance card as well if you have it. It just sort of speeds along the process and helps out our vendors with getting the paperwork in and all of that good stuff. And just something else to note, we do carry both Pfizer and Moderna, but for the kids, we are offering Pfizer exclusively. So for kids 5 through 17, or 3 through 17, sorry. Kids 3 through 17 will be getting the Pfizer as their either primary series or their booster dose, depending on what they're eligible for, just to note. And then if you're 18 and older, you are able to choose Pfizer or Moderna.
Okay. I have some follow-up questions for you.
Sure.
There's no walk-ins. You have to pre-register, or can you walk in to any of these clinics?
So we do ask everyone to pre-register occasionally on the day of if it's not fully booked. Leah, who's in charge of the company we partner with, she'll tell us, oh, we can take some adult walk-ins today, or no, we can't take any today. We never take children walk-ins just because, you know, it's a little bit more chaotic. And so we like to have those folks scheduled in advance to make sure it's all set. So we would definitely ask everyone to pre-register, since it's sort of not something that we won't know if we can take walk-ins until that day. And then usually we'll sort of give people a call who have mentioned they were interested, but it was full or something like that, and say, hey, we do have a couple of open spots if you want to come in. But again, it's not guaranteed. So we do ask pre-registration.
And then how does someone decide? I know for children, you said it's Pfizer only, but how does someone decide Pfizer or Moderna if they have the option?
Sure. Yeah, that's a good question. And there isn't really one answer. As I said, at our clinic, kids can only get Pfizer, but they are able to get Moderna. It just isn't available at our clinic. So they could go to like a pharmacy if they wanted to get Moderna instead. But generally, for anyone choosing between Pfizer and Moderna, there isn't one recommendation from, you know, the CDC or the state or anything like that. You're definitely welcome to either stick with what you've gotten in the past or mix and match. It's not, you know, a requirement either way. So a lot of folks end up just sticking with what they've gotten in the past if they liked it, if they had a good experience. And then some folks sort of just want to get whatever's available. And since we have both, they just end up picking one. But yeah, so you can definitely go either way.
Okay.
It's
So
mostly
it
just
doesn't
whatever you
matter
end up
if
being
you had-
comfortable.
I see. So if you had Moderna as your primary injections, it doesn't matter if you go with Pfizer for your booster.
Right.
I see. Okay, now why do people need to get more shots? I mean, we already how do you know if you need another booster? Why do people need to get boosted? I guess is the main question.
Sure. Yeah. Good question. So say you've been getting sort of every recommended booster and every recommended dose so far, after a few months and, you know, just time is passing, your immunity from whatever your last shot was does start to wane with time. So it sort of leaves you a bit more susceptible, as well as the emergence of new variants that can also make you more susceptible. So that's why we're really recommending the bivalent booster as well, because the new formulation does sort of protect against more of the variants that have cropped up since the beginning of the pandemic. And so that can be really helpful, just so that, you know, you're ready for any variant, hopefully, that comes through Massachusetts or the area, or if you're traveling. It just helps you be better prepared and will help your body fight it off if you do still get COVID. The goal is protection, hopefully preventing the virus, and if not, making sure you have a milder strain so that you can recover faster and get back out there, especially since the holidays are coming up and a lot of folks might want to travel to see family or friends, and we want to make sure everyone can stay safe for that.
Right. So is that why you are having so many clinics in November and December?
Yeah, we definitely want to make sure that we're providing enough opportunities for anybody who needs to get, you know, the booster or a primary series if they haven't yet, and just sort of helping out. I know a lot of pharmacies in the area do offer them as well, and we're just trying to expand access so that everybody can try to find appointments at different times and wherever works best for them to make sure they can enjoy the holidays and have a good time.
As far as hospitalizations and deaths from COVID and the latest variants, what can you tell us about those numbers?
Sure, yeah. So last I checked, which was sort of at the end of last week, and usually I do update Belmont's data for the dashboard on Fridays. So looking at that, our numbers are still remaining low. I think our hospitalizations did go down a little bit, and the hospitalization rate is sort of by region. So that's for Middlesex County, which includes Belmont, as well as the other towns in the county. But our hospitalization numbers are remaining fairly low at this time, which is great. And wastewater data, which is another thing that we look at to, you know, track potential patterns, that's also been remaining fairly low, which is good. And that goes along with our case numbers in town as well. You know, we track confirmed cases, which are only folks who get PCRs, but through the schools, we're also able to see everyone who self-reports to them, you know, so I sort of work with Beth to make sure that there are no patterns emerging with school cases, and that includes rapid home tests as well. So we are able to sort of get a picture of folks in town who are, testing positive either through PCRs or rapid tests, at least to some degree, and see what's going on. So it's looking good right now. Not spiking at the moment. Of course, weather is getting colder, as I mentioned earlier, and we don't know, at any time there could be another variant or another spike due to travel or anything like that. So we're definitely keeping an eye on the data, but it's looking good at the moment.
Okay. You just mentioned Beth. Beth is the head of all the school nurses, Beth Rumley.
Yes, that's right.
And I wanted to ask about the tests. How accurate are the home tests?
Sure. So I don't have like a specific percentage or number off the top of my head. I'm sure if you went online, you could find one either through the FDA or the CDC or something like that. But they are pretty accurate tests. So we do recommend, if you think you've been exposed to COVID, it's good to, put a mask on for a few days, then take a test around day 5 or 6. And you're welcome to do a rapid test for that. That's what we recommend. It's easy to access in the health department. We actually do have rapid tests that any resident is welcome to come pick up. So that's a great resource for folks if they weren't already aware. I know we distributed a lot over the summer, and we're working on a distribution plan now as well. We always give them away at our clinics, and as I said, always have them in the office too. But yeah, so if you think you've been exposed, it's great to test after a few days and, go with the results, whether that's negative or positive, take it as true and follow up accordingly. As well as if you have symptoms, we do also recommend that you take a rapid test then. And if, you have symptoms and they're sort of corresponding with what COVID typically is, and the test still comes out negative, we would recommend taking a second one 24 hours later to check. And if that's positive, then you can follow up with that. And if it's still negative, then, maybe reach out to your doctor and see if it could be something else. Because, it is fall, almost early winter at this point, even though the weather maybe says otherwise, but it is, getting colder, and there are other viruses going around. The flu is definitely starting to go around, as well as other respiratory illnesses. And, while it might seem like it has to be COVID because of all of those symptoms, a lot of the other viruses out there at this time do have similar symptoms, at least some overlap. So it's great to check in with your doctor and just see if it might be something else that, they might have a different treatment for, just different recommendations. But yeah, so that's sort of our stance on tests.
And the tests are, they can test for any of the variants of COVID?
Yes. They are still, they still hold up against any of the variants that we have.
Okay, that's great. So how do people sign up for these flu clinics? Not flu clinics, well, booster and?
Oh, both, yeah. Yeah, so there's 2 main ways. The first and way that we most recommend is through the registration link, which is always linked in the bottom of the flyer. And if it's on Facebook or something, and so it has to be picture format, the link will be pasted in the comment or the caption with the flyer and all of the information. So you can just click right to that. You'll select a time, and then it'll have you enter all your information so that you'll be all set. And most of the time, well, all of our flyers we post on our Facebook page, which is the Belmont MA Health Department on Facebook. So you're welcome to follow us there, and we can always, or you will always be able to see our newest and most current vaccine clinic flyers. We also always have them posted on the Belmont Town website. It should be on the homepage and those slides that are sort of in the middle of the screen, and that'll always have the most recent information as well with the link to register. So if you do have access to a computer and internet, we definitely recommend using the link to register. If you do not, or it's someone who's older who has trouble using the computer, they're also welcome to give us a call in the health department, and we can help you register over the phone. So if that is the case that works best for you, you can call us. Our number is 617-993-2720, and we're happy to help folks register for that. So yeah, those are the 2 primary ways. And if anybody has, questions or trouble registering, they're also welcome to call us if they don't need help registering, but they just have a quick question or anything like that. We're happy to, help work out the glitches as they may come up.
Great. Thank you, Lindsay, for all this really helpful information. And we'll see you again soon. Thank you, everyone, for tuning in to News Now. Stay healthy and enjoy the holidays. Until next time.